Hi, my name is Beth Capabianco, and I'm a registered nurse at VNA Community Healthcare. VNA Community Healthcare Home and Hospice is your local VNA agency. We provide service to people in your community. We appreciate it when you use our services because the monies that we take in, we're able to provide services back into the community, such as this program. Today we're going to be talking about becoming a healthcare advocate and why that's important. In today's society, everybody gets sick and everybody needs to go to the doctor at some point, or somebody has to help somebody else with seeing their doctor. So it's very important to understand what's really going on with people and how we can become a good medical partner with our physicians, because we're going to be needing to make decisions, and we want to be making the right decisions, and we want to be making them with the best information possible. Along with that comes testing, surgical procedures, different types of medications. So it's very important that we use the information that we gain to make smart self-care choices. And again with that, we want to make smart choices that we can have paid through our insurance. We want to learn how we can get our insurance to pay for things, what is covered, what's not covered, because why pay for something if you can get it covered under insurance? Sometimes it's just a matter of making a minor adjustment to get the insurance company to pay for it. So if you're working on yourself or working with somebody else, it's really important to know what you're going to do. So if you're helping a parent or you're helping your spouse or even a friend, you want to make sure that you stay within your role. What are your limitations? Are you overstepping? You want to make sure that you're addressing what the patient's priorities are. Just because you would do one thing doesn't mean they necessarily would want to do it too. So it's very important to make sure that you know what their wishes are. You want to make sure that you legally have the ability to talk to physicians freely. So for example, if I wanted to go with my mother to the doctor's appointment, it's implied the doctor knows we're sitting there together, that he can talk freely, and he would want to know that my mother says that that's okay. However, if my mom's condition were to start changing and I kind of wanted to intervene and I made a phone call to the doctor, he would want her written permission to be able to speak with me when she's not present. So we also want to make sure that we're there for them. A lot of people, especially people who are trying to help somebody else, they always feel that they need to be doing something. And sometimes there's just no answer. Sometimes it's just physically being there, being supportive is all they need. And sometimes you can have two different of an opinion. Somebody may want to be a DNR and you may not want them, meaning a do not resuscitate order. They may be ready for that. They may be having cancer and they may be wanting to make arrangements for their end of the life. But as a care person, you may not want them to do that because you so badly want them to stay with you. So again, it's very important to make sure that you're advocating for somebody else, not taking over and putting your opinions on them. So we want to, when we go to the doctor's office, it's very important to use the put yourself in charge questions. So every time you talk with a doctor, a nurse, or a pharmacist, you want to use these questions so that you can better understand your health. So some of the questions that are important to ask is, what is the main problem? So if you're talking for yourself, you'd say to the doctor, well, really, what is my main diagnosis? There's a lot of people who I've spoken with who have problems, and they're like, well, I have an issue with this, but I'm not exactly sure what I have. It's important for you to be able to know exactly what your diagnosis is so that you can prioritize how you're going to treat yourself. And then you're going to ask the doctor, well, what do I need to do? So the doctor may give you instructions to take to make sure that you can keep your condition under control. So you may go into the doctor and he may say, well, you've got to check your sugar, you've got diabetes and you need to check your sugar every day. And he said, you know, get a glucometer and make a list and tell me, you know, what your sugars are next time you come in. If you just leave the doctor's office, some people may not even know that a glucometer is an instrument that is used to check your blood glucose level. Other people may leave and not even have any clue where to buy it, how to get it. So you want to make sure before you leave that doctor's office that you ask, what do I need to do? And why is this important? As a nurse, I have done a lot of health education for people. My focus has always been teach them the why they need to do it. They'll remember that. If you just tell people, do this, do that, sometimes they don't relate as well to that. It's getting them on board, getting them to understand what's physically happening with their bodies so that they understand the rationale between what they're being told to do and why they need to do it. So it's also important to know what symptoms would be important to report before the next visit. How many times have people gone to the doctor's office because they had a cough and the doctor listens to their lungs and said, well, there's a virus going on, drink plenty of fluids and you'll be okay, I can't give you an antibiotic because it's not going to help. And then this person goes home and over the course of a week or two, the cough gets worse, they start developing more symptoms, and you don't want to say, well, the doctor says it's a virus that, there's nothing he can do. Sometimes a viral condition such as that could turn into a bacterial problem in which you would need to have treatment. So it's really important to ask the doctor before you leave, well, what should I do if the cough gets worse? And let him educate you as to what things to look for and what to report back. And then always ask the doctor, do they recommend any medication changes? An example of that would be, you've had a blood pressure medication since you were 62 years old. And you've been taking that blood pressure medication and say, for example, you were 200 pounds. And the doctor, every time he sees you, says, you need to lose weight, you need to lose weight. So you go back for your next check a year later and you've lost 25 pounds. You might want to ask him, does he recommend any medication changes, because maybe that weight loss will help you control the blood pressure and your medication may need to be adjusted. So it's always a good thing to ask the doctor if you need any medication changes. Again, you want to understand your current health situation. Do you really understand what's being said? You want to let them know, your doctor, your nurse, your pharmacist, if somebody is giving you information, sometimes they use terminology or big words that you just don't understand what they're saying. Some people come from a generation where they just sit there and let the doctor do all the talking. It's very important where if you don't understand something that you stop that person right off and said, could you tell me that in a way where I can understand it? I don't really know what it is that you're saying. Or I don't understand what it is you want me to do. Or this is new, could you please explain it one more time? Or doctor, I don't know really how to work a glucometer. Is there anybody that you can have help teach me how to use it? I'm happy to take my blood sugar every day, but I don't know how to do that. Don't feel embarrassed and don't feel rushed. I tell people all the time that when you're talking to your doctor, it's better to go in there very clear cut and ask the questions then. It's much easier for him to answer your question while you're sitting there and he has your record in front of him, versus when you go home and make a phone call a day or two later, he doesn't have your chart on his desk, he's seen many patients between now and then, and now it's going to take him longer to give you that answer, where had you asked it to begin with, he probably would have been able to answer it quickly, and then it would have been better for both you and the doctor. So again, understand your current health situation. When you go to the doctor, make sure that you go prepared. Go with your list of questions and bring a piece of paper so that as he says things to you or she says things to you, you can write them down. You want to make a list of your health problems and risks. It's a good idea also to keep up with your medical history, your medications, any recent test results, all the different doctors you use, the pharmacies, the hospitals, and your current treatment plans. One of the tools that we use at VNA Community Healthcare is we have these files of life. And inside it has an insert. And you can put your past medical history. You can write your allergies, your different medications. Even a small tool like this can be very helpful for you if you go to the doctor. It's important to make sure that you update it regularly. So if you bring it to the doctor's office with you and a medication change is made, you can put it right on there. This is a very important tool. It will help anybody if you become forgetful or if you have an emergency. This is a great tool. We also have this tool. It's the questionnaire, the Put Myself in Charge questions. and what is my current health problem. You can bring this with you to write down the information as the doctor gives it to you. If you are interested in either one of those, you can get them at the Office of Social Services. You can see Louisa Breen, and she'd be happy to provide that information for you. But again, I often encourage people to have what I call a healthcare notebook. And in that healthcare notebook, people can have the different sections where they would list all these things. And again, with the tests and things like that, you can put them in there. And then if you get any copies of your blood work, you can put that in there too. So if you see one doctor and then you go to another doctor, you'll be able to have access to that information. And it might prevent you from having to have extra blood work if one doctor can see the results. The other thing that's really important is tips for clear communication. Communication is vital, and it's crucial when you're talking about medical care. So I always say bring a friend or a family member with you when you go for a visit, because especially if you're going to get a diagnosis, if you've had a biopsy and the biopsy comes back not favorable and the doctor tells you you have cancer, some people at that moment, everything else stops. They stop listening. All they heard is, I have cancer, and the rest of it, the doctor's mouth is moving and they're not really comprehending anything. So it's very important to try to bring somebody with you. Make a list. Be very proactive. Before you go in, I always say to people, keep a little piece of paper near you. As you go through your day and things happen, if this hurts, if that hurts, if you come up with a question, write your questions down so that when you go see the doctor, you know exactly what you want to ask. How many times is it that we leave the doctor's office and after we go we said, oh, I should have asked this question. You know what I'm saying? If you go prepared, you'll get all your questions answered. And when the doctor comes in and says, hi, how are you? Don't sit there and say, well, my daughter and the I'm getting the driveway done or my roof, because even though those are nice topics, those are things that you can share with people when you're somewhere else. But if you're here and you're talking to the doctor, you really want to have that time to focus on your health status. He does care about, or she does care about your well-being, but they really want to make sure that you talk about what it is that you're there for. If you've been feeling sad or under a lot of stress because of certain issues, put that on your list so it becomes part of why you're seeing the doctor. So then what you can do is you can bring a list of your actual medications and a current medication list. I also caution people, make sure you put all your over-the-counter medications. I once had a woman come see me. She says, oh, I don't take any medication. I just take this one pill. And then I said, well, show me what it is you take. And then all of a sudden she's got this big bag with all these vitamins and over-the-counter things. What people don't often realize is that there are some prescription medications that do interact poorly with over-the-counter meds. And so it's important for your doctor to know everything you're taking. And another thing is if you see a specialist or you have multiple doctors, it's not like they have a party line all the time where every time you leave their office they chat about you. Some of them are on the same computer system, so that makes it easier. So when you do that, it helps with the coordination of care better so that one doctor is not prescribing something that's not going to work with it. And you should always let your primary care doctor know about all the different doctors that you're seeing. Your primary care doctor should know who your eye doctor is, who your hearing specialist is, who your surgeon is, who your oncologist is, and your cardiologist, because they want to make a note of that because it's important for them to be the hub of everything. And it's also good to talk to your pharmacist. I think that the pharmacist is one of the most underutilized free services available to people. They are very, very knowledgeable on medications. And it's not surprising if a nurse has a question, or it's even with the doctors, if they have a question, they'll even go talk to the pharmacist because that's their area of specialty. So that's another thing that you can do. And we highly recommend that you use one pharmacy, so that one pharmacist can have a list of everything and they can see what medications you're taking and if you have any that don't go well with each other. Sometimes I know, especially as people get older, they'll shop around for better prices. Sometimes it's not always worth the monies that you save on that. So again, with your doctor, you want to make sure the doctor is listening to you and that you're listening to them. You want to get right to the point, focus on one issue at a time, and don't embellish. Don't say, oh, my knees are killing me, if they're really not at a high pain scale. Try to explain to him exactly how you're feeling, exactly how strong your level of pain is. And stick to the issues, and again, don't go off track. Speak up. Make sure if he tells you something you don't understand, again, let him know it right away. Use clear and descriptive language. Sometimes people don't know how to word it. I had somebody once telling me, well, my heart felt funny. And they were able to, I said, well, what do you mean it felt funny? And they said, it feels like it's, and they made a noise. But that made sense to me. And it would make sense to your doctor too. And if it didn't, he can ask you to clarify that a little better with that. You want to make sure you have the right care at the right time. Now, unfortunately, we do have a lot of insurance issues in place now. Some people, you have to stay in network. Sometimes you could see who you want to see. Sometimes you have to call up and get permission to see a certain doctor. So we do recommend that you stay in network whenever possible, because those doctors will have a better way to communicate with one another. You always want to make sure that your primary care doctor is your hub. In other words, you want to make sure that the primary care doctor, everything will go through him. Even if you make your own appointment, just call up and let them know, could you put this in my record, or could you tell doctor this? And it will be important for him to know. We try to save specialists for more complex issues. So if you think you have a cardiac problem because you've had a cardiac history or you're concerned, if you feel you need to see a cardiologist, you really should work that out with your primary care doctor first before you go outside. And it's nice when they refer and they have a good working relationship with one another. If you have say for example, like a cardiologist and your friend has one that they think is the greatest, make sure when you talk to your doctor, gee, I'm thinking about seeing this greatest cardiologist that my friend has, what do you think? And run it through them. Another problem that we see is people rushing off to the emergency rooms. Now, we really like to save emergency rooms for true emergencies. There's people that'll use an emergency room for a sore throat. That's not really an emergency. And what'll happen is you go to the emergency room with a sore throat, for example, and then all of a sudden you find that you're waiting a long time and that there's other people doing what I call cutsies. They're cutting in front of you, so you think. But what they're going to do is they're going to take the people who have true emergencies ahead of you, and then they're going to fit you in. So don't be surprised if you go to the emergency room for something like that and you're waiting a long time. The other thing is sometimes the insurance company will deem it not an emergency, and you might have trouble getting them to provide payment for something like that. There are teaching hospitals, and we have teaching hospitals in our area. That's where people go for higher risk procedures because the hospitals are larger, they're doing some training. So again, you have to look at those things when you're making your decision. Do you want to use the smaller hospitals? What is the benefit to that? And what are the risks? And what's the benefits of using a larger teaching hospital? You want to make sure that whatever you choose, that you're getting very good medical help. To some people, the doctor's bedside manner matters to them. That could be one of their most important things. Where other people are like, I don't really care if he's talking nice to me or what, I want the one that's the most talented. It's nice when you can find somebody who's nice and talented. And that's what you do. You find out, you go looking at some people. There are people that don't like to chitty-chat with their doctor. They want to stick right to the facts. So you have to find a fit that's good for you. You also want to check and see what their experience is. How long have they been doing this procedure? How many do you do a year? If you have somebody who's new and they're like, oh, I've done 2 of these, and then you have another doctor that's done 50 of them, well, then you want to see how successful were you with those 2 and how successful were you with those 50. So it's really important to look at things like that. Again, bedside manner. Remember that every industry, no matter where you work, has a customer service issue attached to it. Even with nurses going into your home, if you're inviting somebody into your home, you want to have somebody who's friendly. You want to open the door and see somebody with a smile. You don't want to open the door and have somebody coming in smelling like cigarettes and, complaining about their car and taking, first 5 minutes complaining. And that's where you can look for good agencies and agencies that you're not as thrilled with. Again, it's a matter of even having the person. You may go to one doctor group and there may be one doctor there that you prefer over another. So you just want to pick what's the best for you so that you get the best results possible. Partner with your healthcare professional. Be prepared for your visits. And there are other important paperwork that are essential when getting care. Things like your advance directives. If you're a person who is a little older or somebody with an illness or even a parent, if you've got small children, what are your wishes in case something happens? Let them know if you're going to have an advance directive, if you want to have a do not resuscitate. And remember, what you put in place one day, you can change it if you want to, especially as your condition changes or as your age changes. You want to make sure your information for your insurance is updated. If you go to see the doctor and you have one insurance and everything is going along swell, and then all of a sudden you need to have surgery, but 2 months before the surgery you changed insurances, the doctor's office may be still functioning under the fact that you have a different insurance. And maybe they didn't do a pre-authorization or they have to call somebody. Everybody's time is important. And as somebody who had worked in a doctor's office, it's difficult when you have somebody that you're calling the doctor's office, you're trying to call the insurance company, get the approval, you're going through this person, going through that one, you're on hold, only to find out that you're no longer insured with them. Then the doctor's office has to call you, they have to get the right information, where you could have saved them a lot of time if they had the correct information to begin with. So that's important things too. And you don't want to get stuck with any medical bills. And it's really not, if it's your insurance, then it's really your responsibility to make sure that the doctors have the information they need. So when you do get information, you can write it down. If you want to be clear, you can repeat it back so that the doctor can say, yes, exactly, or not quite, and that would give them an opportunity then to explain it to you more careful. You need to be very reasonable with how much time you're going to take up from the doctor, but you want to make sure that you're assertive in the same time so that you leave there where everybody feels you're on the same page and everybody gets what they need. Fair does not, somebody once told me, fair doesn't mean that everything is equal. Fair means that everybody gets what they need. So you want to act to make informed decisions. Again, you're going to ask about your problem and treatment choices. So the doctor may say, I want you to take this. And you can say, well, could you tell me why? Are there any alternatives? Ask about the risks and the benefits of each choice. So the doctor may say, well, you can either have surgery or we can try this medication, and have him tell you the benefits and risk of each so that you can weigh those options so you can take action. So again, you want to know what your exact diagnosis is, what caused it, how long will you be sick, and how long will it be before you see any improvement. In other words, the doctor may say, well, I want to send you for this very expensive test. And you may say, well, what is it that you're looking for? What will the results be? And you have to look at what his answer is so that you can make an informed decision. Again, we look at things like the benefits. Is the benefit of going to be a cure, pain relief, symptom control, reduce the risk of any other complications? Will they help you function better? Will it just be for peace of mind? Or is it more for a diagnostic reason to help you find out what's really wrong? What are the risks associated with it? Could you die from this procedure? Could you or will you be left with any form of disability or have further injury? How much time will you be out of work? And how long will you be needing some help, or will you be temporarily incapacitated where you're going to need to arrange for help to come in after this procedure or test? How much stress is this going to put you under? And how much pain is it going to be? So again, Do the benefits outweigh the risks? And that's something that I always tell people to look at when you're trying to make a decision. So when do you want to speak up and advocate for yourself? Well, obviously if there was a clear mistake made, or if things were getting worse and nobody is giving you any answers, or you don't feel that the explanation is adequate. In other words, the doctor just says, oh, don't worry about it. Well, you might want to say, well, why would I not worry about it? Is there something you're not saying? Or do you feel it's too complicated for me to understand? Can you simplify it a little bit for me? When you have two doctors or you have two people taking care of you who are not communicating well with one another, are you in the hospital and did somebody come and just give you a treatment and somebody else is coming in to do the same thing for you? So you want to make sure that people are communicating. You want to make sure that people are following up. So if the doctor's office says, or if the hospital says, we're going to call you in 2 or 3 days, and 5 days have gone by and you haven't heard from anybody, you want to make sure that you tell somebody. What we don't want to do is just sit there and say, oh, they may be too busy to help me out. You need to step up, and some of the accountability falls on both ways. Just because, for example, if I'm a housewife and I'm, very busy and I'm behind and I have a lot of things to do and I have an appointment to get to, but I have dishes in the sink, I can't be angry with my husband for not just jumping in and doing that, because maybe he has no clue that I would like some help with that. It's up to me to say, honey, would you mind helping me with the dishes this morning, and put them in the dishwasher? Good probability that sometimes that would help. Communication is key. And however, had I gotten home from the doctor's appointment and he said he was going to do the dishes and yet they're still in the sink, well, then I need to do some follow-up and say, oh, what happened? Maybe something happened to him and maybe he wasn't feeling well or something. There might be some reason, or it could be that he simply forgot. Sometimes people just simply forget, or they misplace a piece of paper, so we can help them. If it's my body and I want to make sure that I'm getting the best care possible, if somebody told me they'd call me in 3 days and I haven't heard from them, I would make sure that I called them in 3 days to either remind them or to get next in line. Nobody really should have to deal with rude behavior or neglect. So that's another thing where we're looking at people's personalities. If things are not adding up and not looking right, remember, you're a consumer. Just like how I said before, there's customer service when you're dealing with health professionals. There's also being the consumer. And if you're purchasing a product that is not up to your standards or where you don't like, it's time to shop and go to another place. We want to make sure we watch our medications. Again, one pharmacy, and keeping our lists up to date. Make sure you have a clear understanding of your drugs. So you don't want to say, well, what do you take? Well, I take a little white pill. You, again, should know what your little white pill is and why you take it. It's very important for you to have a clear understanding of what you're taking. Again, it's going into your body, and so it's important that you understand what it is that you're doing. So you want to keep your pills and your blood tests organized. Some people, the doctor will give you a medication and tell you you need to have blood work to take that medication every 6 months. He really needs to have the results from that so that you get the best care possible. If he's telling you you need to have a blood test and you don't do it, and then you suffer from a complication because you didn't have it, a lot of people want to go back and blame the doctor. But he tried to have you do something. He can't drive to your house and pick you up and take you to go have the test. You need to make sure that you follow the instructions, take things as directed, and have your tests the way you're supposed to have them. That way there your doctor can know what's going on with you so that you can understand when he makes changes, and he can understand if a change needs to be made. So when you're starting a new drug, you want to make sure that you can ask your pharmacist 7 questions. In other words, why should you take the drug? Is it safe? How will it work with the other medications that you're taking? How should I take it? Some people think they should take all their medications in the morning. And that's not true. Maybe you don't have to take it in the morning. Maybe you could take it at night. And those are the things you can talk with your pharmacist about. Can you take it with certain foods? There's certain foods, for example, grapefruit juice. You might not want to take that if you're taking certain pills. So Also to know what the side effects are. And if your insurance isn't covering it or if money is an issue, is there a generic form of this medication that you can use instead? So pay attention to how you feel. Write down any side effects you have and talk to your doctor about any concerns. We don't like you to just stop abruptly taking the medication without your physician knowing about it. Some medications have to be taken away slowly. Other medications take a few weeks before they start kicking in and taking effect. So don't give up. Make sure you keep all your follow-up appointments with your doctor. And again, don't stop taking it before you're supposed to. And be honest with the doctor. If you think you no longer want it or you really don't want to take it anymore, be honest and tell him that. Because if you go into his office for a follow-up visit and he's assuming that you're taking the medication and you're hiding it from him that you're not, he may make a judgment call or a suggestion that's not based on fact, and that puts everybody in an unfortunate situation. So be honest. Use smart self-care. Know what your normal is and how you normally feel and what's different. Follow up again on your treatment plan as outlined by your doctor. Follow your diet, follow your medications, get your testing done. Respond to any red flags. Ask him while you're there, is there anything I should be watching out for? And those are your red flags. Watch out for them. And know what you're supposed to do if they happen. Call the doctor's office or your primary care doctor when you're worried or unsure. If you have a visiting nurse, we always like to know when things are changing in your condition so that we can help you nip them before they become a problem. And again, use your insurance wisely. Know what your plan is. Be familiar with it. If you have a managed Medicare plan, you have to be very careful where you do certain, where you get certain treatments or what you can have. Certain insurance companies won't pay for certain tests. They want you to have other ones first. You want to make up that you follow your plans and all the rules that you've are signed up for. That's why I say don't always go with the cheapest, because that may limit you right to the point where it ends up costing you more money. So make sure that you can look for any special deals and discounts, but research them. Make sure that if there's limitations or you have to use doctors within the network, that you're willing to either leave your doctor or that your doctor is part of that plan. And know what your rights are and know how to make an appeal if they do deny a claim. So before we end, I did want to show you an example of communication. And it's really important to make sure that we ask the right questions. And this is an example of how that works. So if you could let me know if we can't hear it, I can put some speakers.
Your granddaughter, she was with you last time, couldn't come today. Oh, no, she's sick and she couldn't come today. I'm sorry to hear that. How have you been doing since you were discharged from the hospital? Well, if I was short of breath if I moved too fast. And my ankles swell sometimes, but not enough to call you a bit. Given those symptoms and your tests, I think it's time for a stronger medication. Tell me, do you remember the instructions that the nurses gave you at the hospital? I remember everything the nurses told me, and I'll do whatever you say. Okay. Here's a new prescription. Take one of these each day in the morning. It'll make you urinate more frequently. Then it shouldn't cause any troubles. And I'll see you again tomorrow. Oh, doctor? Yes. Oh, nothing. I know how busy you are. I'll ask you next time. Okay. This patient simply did not ask enough questions. Patients who don't understand their health problems and treatment can't care for themselves properly. Passive patients may later remember questions they forgot or were afraid to ask. Then they will have to call the doctor again. By not asking questions, patients may get confused about instructions, may not prepare for tests properly, or may take medications in the wrong way. Patients who don't ask about tests or treatment may have tests they are not sure they need, or may take medications they are not comfortable with. To avoid these problems,
Bring a small card or notebook of key questions. Write down your own questions before you go on the visit. To be sure your doctor makes time for your questions, say at the start of the visit, "Before I go today, I have some questions that I would like to discuss with you." Be sure to ask these key questions. 1, what is my main health problem? 2, what do I need to do? 3, why is it important for me to do this? 4, what symptoms would be important for me to report before our next visit? 5, do any of my medications need to change? Hello, Mrs. Adams. Hello, Jenny. It's good to see you both here today.
My grandma left her last visit a little bit confused. Would it be possible to take some time to answer a few questions?
Of course. I know these sessions can seem rushed, but there's so much information we have to exchange. Please.
Grandma, you have the little card. Go ahead and ask them.
Dr. Wilson, what exactly is this problem you're treating me for?
It's called heart failure. I know that sounds scary, and it is serious, but we can control it with medications. What it means is that the heart muscle has been weakened by the 2 heart attacks that you've had. The heart is a little enlarged. It doesn't pump as efficiently as it has in the past, and therefore some fluid can back up into the lungs to cause breathlessness or into the legs to cause swelling.
What do I need to do to treat it?
Primarily take the medications as they're prescribed. I'll ask one of our nurses to sit down with you before you leave and help you generate a list of your medications and also make sure that you understand them all. And it would really be helpful if you would avoid salt in your food. Salt makes the body hold on to water, which means even more volume for the heart to be pumping around.
Why is it important for my grandma to do these things?
Well, we want her heart to function as efficiently as possible and to avoid getting any weaker. I guess the primary goal is to keep you out of the hospital.
I'm not sure always when to call you. What symptoms would be important to report back to you before our next visit?
You should promptly report any increase in breathlessness or leg swelling. You should also weigh yourself daily in the morning after you've gone to the bathroom, but before you eat. And report to me if you gain 3 or more pounds from one day to the next.
Are you going to change any of my medicines? The last one cost so much, I'm not sure I can get the next prescription filled.
Oh, I'm very glad that you brought that up. What I can do is to prescribe a generic drug that will do the same things for you, but will cost less.
Oh, I'm glad I brought it up too. It's been worrying me.
Good.
Okay. So when we look at that video, we can see the difference between good communication and poor communication. The first example, she sat there, she said, "Oh, I understand everything," and the doctor was good with that. And what happened is she left there not really having a good understanding of what happened. Now, when we look at those videos, we can see that, you can shut that off for me. Just close it, please, thanks. We can see that being prepared made a big difference for her. She brought with her her card, and she had her questions there. What else was it that we noticed that happened in the second video that didn't happen in the first video? She brought her niece with her. She brought her niece with her, and the niece made things very good because she started right off the bat with the question, and once that door was opened, did you notice how the patient then started asking and getting into the card and started being a little more effective with her communication? And in response, the doctor's communication also improved. By asking those questions, she was able to get more information and learn more about what was going on with her health situation. They were also able to the doctor was also able to realize that she wasn't as knowledgeable as necessary and actually made arrangements for her to speak with one of the nurses in the office so that they could talk about the medications, create a medication list, and so she was going to leave there much more informed. They also talked about, remember we brought up those red flags with the health condition? The doctor actually sat there and listed all the red flags, all the problems that she could have, what to do, why to do them. For example, getting on the scale and weighing herself every day. And he told her why she needs to do that. People tend to be more apt to do what the doctor tells them to do if they understand why they're needing to do that. And the other thing is that at the very end, she asked about those medications, and not only did she get the education, but she also ended up saving money in the long run. So I hope you enjoyed today's presentation on becoming a healthcare advocate. And whether it's for you that you're advocating for or for somebody else, I hope that you got some useful information from today's presentation.
Question.
Yep.
When you're at the doctor's office and they prescribe a medication, do they generally give you the generic brand first or the top of the more expensive one? And you have to ask.
It would depend. When the doctor gives you a prescription, you can ask him.
Let's say Crestor, for example. Crestor, and it's called Sebastian or something like that.
Yeah, simvastatin. If the doctor gives you a prescription for something and you want to ask that, say, doctor, is this a generic brand or is it the name brand? And you might want to ask him, is there any difference between the two? Is there a reason why you're prescribing one over the other? And you can also check with the pharmacist. Believe it or not, some insurance companies will only pay if you get the generic. However, there's some insurance company that if the doctor got a pre-authorization for the medication, and the pre-authorization for the medication was made in the trade name, meaning the name from the company, then that's what they approved. So they won't pay for the generic in that case, they're only going to want to pay for the trade. So it really is a good question, and that's a question for both the doctor and the pharmacist.
Oh, yeah. It makes a big difference sometimes.
Yeah, well, some of them are much more expensive, but sometimes they like to do things for a reason.
Oh, okay.
You know, sometimes the way that medications are packaged and delivered, if they're under a trade name, maybe they're easier to manage versus another drug that might be not as easy. Sometimes it doesn't really matter. So, any other questions?
There's so many today, and most generics work well. I mean, there may be some exceptions that don't work well with the name.
And sometimes a drug is available by its trade name because the drug manufacturer put a lot of time and money into developing that drug, and it may not yet be available in a generic form. So not every medication is going to have its generic form available to you.
It helps sometimes. Yeah. Nice job.
Oh, thanks.
Oh, I had been taking Lipitor for years and years, Lipitor. And I started developing leg cramps terribly. So I went to the doctor and she took me off of that and put me on Actor.
Okay.
It's kind of like a lesser, how should I word it, lesser drug than the other.
In other words, you're going to get a similar effect, but by using a different drug.
It's probably milder, yeah. So I've been on that, and then I went for blood work. And she called me yesterday and said that my liver enzymes were elevated. So now I have to go for an ultrasound. So I'm wondering, because I don't drink, but it's something to do with your fat system.
The doctor, that's why the doctor is running the test. So you're going to work closely with your doctor.
Yeah.
You're going to pay attention to what's going on in your body. You're going to make note of any changes because you know your baseline. And then that information, along with the results of the test, is going to help your doctor determine what it is that's causing those test results to be the way they are, and then hopefully can make some adjustments in your treatment plan so that that's not going to happen.
Okay.
And she can take a yellow cheat sheet with her so that the next time she goes to the doctor, she can ask her important questions.
And also make sure that your doctor knows about all the other medications that you're taking. So, and again, over-the-counter medications, everybody always says, oh, my doctor is the one that prescribes them. They know everything I'm taking. But like I said, with that other patient that I had, she had a whole bag of vitamins and and all these different kind of supplements that she was taking. And believe it or not, sometimes those will wreak havoc on some prescription drugs. Again, it's very important that your doctor knows everything that you're doing and continue to have the tests that the doctor suggests and know what your red flags are. And together with your doctor, you can work to come to a hopeful positive solution.
Well, you know, she has all my medications in her computer, so she knows, you know.
As long as patients give the doctor the information, the doctor can have it in there.
Yeah.
Again, I do know a lot of people who take melatonin because their friend told them it helps them sleep. Or they take, well, I decided I'm going to take a senior vitamin and I don't think I get enough vitamin C. And years ago, the doctor told me I should worry about my bones, and now I take some vitamin D. And people are taking, you know, herbal this. And it's really important that those medications, even though you can buy them over the counter, and they are from a nature food store, or they're all natural, your doctor still needs to know what it is that you're taking.
Yeah, because I was taking lorazepam for a number of years. I find it wasn't, you know, helping me anymore.
And a drug like that would be a drug that if it's not working, you would want to work with your physician.
Yeah.
And if you don't need it, by all means, you don't want to be taking any extra meds that you don't need.
She told me that that's kind of dangerous for a woman my age, 81, because I've been taking it for a long time. So she suggested the melatonin, the 1 milligram.
There you go.
So
see how, and you can go from a drug that's a prescription drug, that's kind of a little more heavy duty, than going to something that's a more natural supplement, just by bringing up the fact. And again, just like I talked about the situation where the man might have lost 25 pounds, he was also older. Just like you, what may have worked when you were 70 or in your 60s was one thing. Now you're in your 80s, that medication A is not working the way you want it to, and it might be a little strong for your system.
And it's dangerous for my age.
Right.
I didn't even know that.
So you made it, so that was a very good, bringing that point up to the doctor.
Yeah.
Was a very good decision, because you ended up with a better result at the end. Yeah. Okay. Any more questions?
That's it.
Great. Thank you very much. Thanks for coming today.
Thank you, Beth.